Västerbotten County broke its record today of having the most coronavirus patients in the hospital at one time. Right now, there are 33 spread out over the 3 hospitals in the region in Umeå, Skellefteå, and Lycksele. The previous record was 29 on April 10th. With me is Västerbotten Health Director Brita Winsa. She helps oversee operations on the ground in the clinics. Brita, thank you for being with us here on Umeå today.
Hello.
Brita, can you describe the situation right now in the hospitals, particularly in Umeå?
Well, the situation is, I would say, under control, as we say it. We do have more patients than we've had before. As you said, we have about 33. That varies a lot, sometimes from hour to hour. But we do have, there is a, what do you say, strain in the wards and on the staff working there. But what is fortunate, and I would say so much different from this spring, is that we only have 5 in the emergency wards. So there are fewer patients in the emergency wards if we compare to the spring, where we had the whole time we had like half of the patients were in the emergency wards.
Right, the high at one time.
In the intensive care units, I would say.
Intensive care units,
yeah,
yes.
Right.
Yeah. And in April, the high actually was 13, and right now we have 5 or 6, as was reported by the region. Why do you think the smaller percentage of the population is in intensive care right now?
I think there, of course, it's always multiple reasons, but I think the main reason is that we know how to take care of the patients in a better way now. So they do get better treatment right when they arrive in the hospitals. And also it might be that they are somewhat younger. I'm not really sure about that, but the main reason is that we are taking care of them in a better way. We are giving them better medication. We know more about the disease now, so we are able to take care of them in a better way.
We also have 2 new reported deaths in Västerbotten in the last 24 hours, and that means that more people have died from the virus in this past week than even during the worst part of the spring peak. So what, in your mind, accounts for the high death rates right now during our second wave?
Well, I don't really have the numbers on these patients when we talk about how old they were, but I think that most of these, the ones that have died, are older, very, very fragile patients who are staying in places where they are not living at home, and they are usually. They have other diseases, they are old, which we know is a risk factor, and they are fragile, I would say. So they are very vulnerable for the COVID. And I think there is a spread in the community that has spread even to the elder ward. Well, places where older people live.
Nursing homes.
No, nursing homes, right.
Yeah.
And that's the reason why.
Can you give us specifically information about how the situation is in Umeå? For example, how many patients in their hospital here?
In Umeå, we have 13 patients in the hospital and 3 in the intensive care unit.
So 16 total?
Right. No, 13 in total. So
13 in total.
13 in total. And I do know that I think during yesterday and the day before, we have transported some patients from Skellefteå to Umeå, because I would still say that the situation is somewhat worse in Skellefteå. There's more spread in the population and also a higher strain on the healthcare, on the hospital.
Thank you. And finally, what's your latest and newest advice for Umeå residents to help stop the spread of infection?
Well, it's still the same. Keep the distance. Don't meet people you don't know, and meet as few people as you can, and keep a distance.
Great, thank you so much. That's Västerbotten Health Director Brita Winsa. Brita, thanks for being with us on Umeå today.
Thank you.